Okay, let's unpack this. For millions of people, grappling with depression, finding consistent relief, lasting relief, it isn't just about taking a pill.
Not at all.
It's often this really frustrating, long journey. Maybe one medication doesn't work, then another, maybe even a third.
Exactly.
So today, we're really going to dig into what happens when those traditional antidepressants fall short. And maybe more importantly, what innovative options are actually out there when you feel like, well, you've exhausted every path. Because for a lot of people, this isn't just, bad luck. It points to something distinct, a clinically recognized condition.
That's exactly right. What you're describing there is what we call treatment-resistant depression, or TRD.
TRD, okay.
And it's really crucial to understand this isn't a reflection of someone's willpower or motivation or effort. It's a diagnostic term.
Right.
It's used when someone with major depressive disorder doesn't get adequate relief after trying at least 2 different antidepressant medications.
2 different ones.
Yeah, and critically, each one needs to have been taken at an appropriate dose and for a sufficient duration.
Okay, so dose and time matter.
Absolutely. And if that frustrating cycle sounds familiar to you listening, you are definitely not alone. Statistics suggest that up to, well, maybe a third of patients with depression won't find the relief they need from those first-line traditional routes.
Wow, 1/3. That's significant.
It really is. And it suggests something more complex is going on than just needing, say, a different pill or a higher dose. It hints that the brain might need a more targeted kind of intervention.
Targeted.
Yeah, one that goes beyond just adjusting the overall brain chemistry.
That really makes you think differently about depression, doesn't it? So if it's not simply about finding the right pill, what is it about traditional antidepressants that makes them fall short for so many people? Why aren't they always enough?
That's a really key question. The challenge with many traditional antidepressants, the way they work, is that they're systemic.
Systemic.
Meaning they impact the entire body. They're circulating through your bloodstream. They're not just zeroing in on the specific brain regions that might be most affected in depression.
Ah, okay.
Think of it like maybe watering your entire garden hoping one particular flower will perk up. It's a broad spectrum approach.
Right. Not very precise.
Exactly.
Yeah.
And that systemic action is also why people can experience those well-known side effects, things like weight changes, sexual dysfunction, trouble sleeping, or sometimes feeling emotionally kind of blunted.
Because the medication is going everywhere, not just where the depression lives, so to speak.
Precisely. It's casting a really wide net.
So if the issue isn't just this broad chemical imbalance, and it's definitely not a lack of willpower, where do we look next? What kind of approaches are actually designed to address maybe those underlying electrical patterns you mentioned earlier?
Yeah, what's truly fascinating here, I think, is how treatment-resistant depression is really pushing us to reconsider how we understand depression itself.
How so?
Well, historically, the focus has been heavily on chemical imbalances, right? Neurotransmitters like serotonin.
Sure, that's what you always hear about.
But the fact that TRD is so persistent,
Right.
even after trying multiple chemical approaches, it strongly suggests the problem might lie more in the brain's fundamental electrical activity.
The circuits.
Exactly, the actual circuits that regulate our mood, our thinking, our ability to feel pleasure. It might be less about a shortage of a chemical and more about how those circuits are firing, or maybe not firing correctly.
Okay, that makes sense.
So if medications haven't managed to reach the source of the symptoms, if they haven't effectively retuned those specific circuits, then just upping the dose or switching to another similar drug might not ever fully solve the problem.
Which explains why people can get stuck.
It does, and it really raises this important question about treatment strategy, shifting from that broad chemical approach towards something more like precise neuromodulation, adjusting the electrical function directly.
And that shift, that brings us neatly to transcranial magnetic stimulation, or TMS, which sounds like a completely different pathway. So tell us more about TMS. How does it work, and how does it manage to be so targeted, unlike the pills?
Right, so TMS is a non-invasive treatment. It's FDA cleared specifically for TRD, and it works by using magnetic pulses generated outside the head to directly stimulate specific brain regions.
Magnetic pulses, so no surgery or anything.
No surgery, absolutely not. Patients are fully awake and alert during the treatment. The key thing is that TMS can zero in very precisely on a particular area, typically the prefrontal cortex.
The prefrontal cortex, remind us what that does.
You can think of it as sort of the brain's control tower. It's heavily involved in regulating emotions, making decisions, planning, really crucial functions that often go awry in depression.
Okay.
So by delivering these focused magnetic pulses to that specific spot, TMS aims to, well, gently retune that area. The goal is to gradually restore healthier patterns of brain activity, the kinds associated with better mood, more emotional clarity.
That sounds incredibly promising, especially, for people who felt stuck in that cycle for so long. Beyond that targeted precision, what are some of the other key benefits of TMS that listeners should know about?
Well, the benefits are pretty compelling, especially when you compare it to systemic medications.
Like the side effects.
Exactly.
Hmm.
Because TMS delivers those magnetic pulses only where they're needed, right at the source in the brain, it completely avoids those systemic side effects we talked about earlier.
Ah, because nothing is going through the bloodstream.
Correct. No weight gain, no sexual side effects, none of that. Because the treatment isn't circulating throughout the body. Patients stay awake, they're alert during each session. A typical session is usually quite short, often 20 minutes or even less.
That quick.
Yeah, it's efficient. This makes it generally very safe and well tolerated. And another really important point for many people is insurance coverage.
Right. Is it covered?
Yes, most major insurers, and that includes Medicare, do cover TMS for eligible patients who meet the criteria for TRD.
That's huge.
It is. The typical course involves coming in for sessions regularly, usually daily for about 4 to 6 weeks. The idea is that this consistent stimulation helps gradually restore that healthier brain activity we're aiming for.
It really sounds like a potential paradigm shift for people struggling with TRD. So after hearing all this, you might be listening and asking yourself, okay, is TMS right for me? Who is it specifically designed for? What are the criteria?
That's a great question. Our sources really highlight who tends to be a good candidate. It's typically for those individuals who've already tried at least 2 antidepressant medications without getting significant relief.
The TRD definition we talked about.
Exactly. Or it could be for people who do get some benefit from meds, but they experience side effects that make long-term use really difficult or undesirable.
The trade-offs.
Right. And it's also a really powerful option if you're specifically looking for a non-drug alternative, something that addresses depression directly at its neurological source rather than just chemically.
So maybe someone who just prefers not to be on medication long term.
Potentially, yes. I've worked with patients who, after years, literally years, of feeling stuck, trying different pills, feeling exhausted by the whole process, they experienced a really remarkable shift with TMS. It's almost like gently reminding the brain how to get back on track electrically. It allows them to reconnect with life in a way medication just couldn't quite achieve for them.
That really does offer a beacon of new hope, doesn't it, for those who might genuinely feel like they've run out of options. Now, this exploration into these advanced depression treatments is brought to you by Sabres Medical. They're dedicated to distributing advanced, research-backed TMS systems. You can learn more about their work over at blossomtms.com.
If we try and connect this to the bigger picture,
Yeah.
what becomes really clear is that depression doesn't always respond to the first treatment attempt, or even the second or the third.
Yeah.
And this is the crucial part, that absolutely does not mean recovery is out of reach.
That's the hopeful message here.
It is. What's truly, I think, revolutionary about approaches like TMS is how it reflects our evolving understanding of depression. We're moving beyond just thinking about fixing a chemical imbalance
Right.
to actually considering how we can retune the brain's fundamental operating system, its electrical activity. With the right tools, including these innovative therapies, real relief from treatment-resistant depression is genuinely possible. We're talking about solutions that aim to go beyond just managing symptoms day to day.
Addressing the underlying function.
Exactly. Addressing the underlying brain activity itself.
This really makes you think about the power, maybe, of reclaiming some control over your mental health through understanding how your brain actually functions, beyond just those traditional chemical explanations. It really does feel like it opens new doors. So a final thought maybe for you to mull over. What stands out to you about how understanding brain activity, this electrical side, can open up these new avenues for treatment, especially when maybe other things haven't worked?
It's a profound shift in perspective.
It really is. And remember, whether you're a patient looking for answers for yourself or a loved one, or perhaps you're part of a clinic looking to expand your mental health service offerings, Sabres Medical is there to help explore taking that next step forward. You can find out much more about TMS technology and how it supports individuals facing treatment-resistant depression at blossomtms.com. That's blossomtms.com.